Hello, everyone, and welcome. We're going to start now. There may well be some people joining while we are getting started, but we'll let them catch up. My name is Corinne Schuster-Wallace, and this is Ron, and we're going to host this webinar for you. And it's a webinar in the Canadian Coalition for Global Health Research, the Working Group on Climate Change. And we appreciate you attending however many webinars that you've been participating in. This is the last one for 2018, but we will be starting up again in 2019. So keep an eye on the Twitter and the emails and the website for any information on the next webinar. And I'd like to introduce you to Ron. He's a pediatric emergency room physician, but he has a lifelong interest in global health, and it's taken him to multiple countries around the world. And for the last 10 years, he's really been focused on Mozambique. And today, not only has he graciously agreed to share his projects with us, but he's also agreed to put a climate change lens on his projects, on its potential impacts on the present and future maternal health, both his, and hopefully it opens up the dialogue for us to look at more broadly at the maternal and newborn and child health projects around the world. So we're sat together in the same room, which is a first difference for many of the webinars if you've been to others. And we're looking to do this a little bit differently in terms of we've got a couple of short presentations by Ron, but we're going to engage in more of a dialogue between the two of us. And then, of course, we'll be opening it up to you to engage in the dialogue more broadly. So welcome, sit back, enjoy, and I'll hand it over to Ron.
Well, thank you very much, Corinne, and I'm sorry that you're not feeling well today, but welcome to all of you from a warm Saskatoon, Saskatchewan. It's actually above zero right now, I think, so we are all dancing in the aisles. And I can see that we've got our first slide up here from the project in Mozambique, and I'd just like to take you through a little bit of what we're doing in this project right now. I've had the pleasure of working with a number of people on a maternal child health project over the last 3 years, and we have another 2 years to go. And when Corinne approached me about this webinar, we thought it was a great idea to review how climate change is really affecting some of our projects. So welcome to Mozambique. We'll take a few minutes to just introduce you to a few things here. First of all, our project is called the Alert Community Prepared Hospital Project. And this is a logo made by one of the university students in Mozambique working with us. It shows that the color of green for hope in Africa, the traditional Mozambican headdress, the whole community around the women supporting them, and the use of both languages, English and Portuguese, given the partnership between Portuguese-speaking Mozambique and English and French-speaking Canada. So the Alert Community Prepared Hospital project is a maternal child health project that is supported by the Universidad de Lourdes, which is a national health sciences university that's now 10 years old, and it's situated in the north of Mozambique in a place called Nampula, and the University of Saskatchewan. The money for this project has come from the Innovating for Maternal Child Health in Africa initiative, which has been funded together by International Development Research Centre Canada, Global Affairs Canada, and CCGHR, Canadian Institutes of Health Research. So we're very thankful for their support through the project and their funding. With this project, what we looked at, what our biggest concern was that many people were doing really good small things in parts of maternal health, but the projects were then not being sustained or not going forward because it only dealt with one part and the rest fell down. So we took some of the older literature based on the 3 delays model, where we want the woman and family to understand when and where they need to seek care. Then we want them to be able to access care. And when they do arrive for care, we want them to be received by appropriately trained members of the healthcare profession to give them safe and timely care. So these are the 3 delay models. So we really wanted a system-wide approach to maternal health. So we started with the community, and in the community we're focusing on adolescents because of 50% of the population of Mozambique is under 20 now. It's a very young, vibrant, growing country, keen to develop. So we're focusing on adolescents, but also on the community as a whole. We are doing a number of things to try to address sexual reproductive health and maternal health in the community. I've listed some of these here. We've gone into the school and we've trained adolescent peer mentors in sexual health and family planning and contraception. We're working on introducing modern family planning into initiation rites so that children and adolescents who aren't in school still pick up some of these important things during their initiation, which is a significant ritual in Mozambique. Thirdly, we are taking the local health committees, which are volunteer groups in the community that work closely with the local hospital and are spread out through the community to pass on local health messages. We're teaching and working with them to pass on appropriate sexual reproductive health messages. We've also made radio and theater spots to share these messages, and it's just great joy to watch the theater group present under the mango tree to large numbers of community members who are laughing and enjoying the day as a whole. We're working closely with traditional birth attendants, and also one of the questions brought up by the community when we had meetings with them was the bribery and corruption in healthcare, and we're addressing this closely. So that's what we're doing with the community. With regards to access, we're really excited about this. We have a Mozambican gentleman here in Saskatoon who's an artist and a welder, and he built a prototype of this trailer. We tested it on the prairie potholes and farmland, and then he took the computer-assisted drawings over to Mozambique, found materials there, built 6 of these, and the project is now using them to bring women in from the community to the hospital in labor or in difficulty. We did this because as we watched the labor records, on the labor record, there were actually tick boxes, and one of the boxes was, where did you deliver? At home, at the hospital, or on the road? And very commonly, people would be checking on the road because they had to walk long distances to get to appropriate care. So we're really excited about this access that's not only built this motorcycle trailer system for the community, but has also started a business as he is now got a contract for 10 more with another group. And we're hoping to have the government see these in action and our research showing them to be effective. And hopefully the government will buy into these in a big way. Third thing is working with the healthcare workers. We've used the Helping Babies Survive program from the American Academy of Pediatrics international section, and we're teaching newborn care, essential care, and we're also teaching emergency obstetrical care. I use the word we, meaning we've given resources like this to Mozambican experts who are teaching their Mozambican colleagues these things. And we've also given money to equip operating room for cesarean section so they can be done safely and appropriately. And our Mozambican colleagues have provided human resources to staff the operating room and provide service. So this is our 3-pronged system-wide approach to healthcare and to maternal child health. And so that's the project as a whole. And I'm going to just stop there for a minute, and we'll just pass it over to Corinne. I think she has a question or two that you might want to add.
I do. Thanks for that overview, Ron. And of course, we're here to talk about climate change, and you have implemented a comprehensive project and not only focused on those 3 delays, but knowledge in schools, knowledge in communities, and also knowledge in the healthcare facilities themselves. But Did you consider climate change?
Well, the answer to that is no. And that's why this webinar and preparing for this webinar has been quite interesting, because 3 or 4 years ago when we were working on the planning for this, climate change was present, but not really as much in the news as it is becoming more and more every day.
So now that you've prepared for this webinar, when you're reflecting back, are there any things that you would do differently, or any reflections that you can share with all of us about the project and climate change?
Well, it's interesting. We looked at the motorcycles, for example, and we could have bought smaller motorcycles at a cheaper price. But we know that the roads are changed dramatically at different times of the year. So we made the trailers so it was much better suspension. We made the bikes so that they can either pull straight down the middle of the road, or if there's too much grass in the middle, they can change the trailer pull so they can pull from the side of the 2-lane road. And we see as the terrain either gets more wet or more dry from climate change, these bikes are set to deal with any one of those.
So, an inadvertent.
Yes, an inadvertent positive,
right,
which is nice. We are using, as the healthcare system in Canada does, volunteers are often the backbone of the healthcare system. And so we're seeing that with our volunteers, they're going to be having to spend more time on their small farms and things to eke out a living as it becomes drier, or as climate changes lead to more difficulties. So that's, we need to look again at how we do that. And that's always a difficult situation, how to support your volunteer staff in the best way. We also, with climate change and trying to become more green and eco-friendly, we looked at bicycles instead of motorbikes, but really we needed a turnaround time in a 20-kilometer distance of under 2 hours. And I do some cycling for sport, and on a nice paved road with a good bike, one might be able to do that, but in Africa, that just does not happen. So sometimes we have to use what's appropriate for the situation. We didn't really get too worried about water in our project, but certainly now I would. And we didn't do water because, quotes, other people were doing water. And now going through things like this, it's just interesting to see how water is so tied into anything and everything that we do.
Well, and of course, that's my background. So absolutely, it's really important, and it's interesting that there are groups in a community or region doing water projects and you doing a maternal child health project, and yet there's no integration or opportunity to leverage off each other, whereas it becomes really important when you think about water fetching and pregnancy. Water fetching is hard, long work, especially with climate change perhaps making it warmer and drier. So you've got the heat exhaustion, you've got the expenditure of calories, you've also got the instability of being pregnant, and you have the distances that you may have to go, as I say, increasing. And so that burden, the fatigue, and the calorie sort of use or uptake is all part of that additional burden from being pregnant. And it's interesting you talked about the volunteers, because in some ways they're also a conduit for you for climate change health education. And so, yes, understanding where they are and when and the spaces they're occupying and how that might change into climate change, but also then the alternative where the volunteers can actually be used to provide education and support their communities with climate change challenges. So again, opportunities as well as challenges. I do want to change track a little bit. It's still water related, still maternal health, but around vector-borne diseases, because we know that vector-borne diseases, particularly malaria, it's a real problem in pregnancy with anemia. So then you get increased hemorrhaging during childbirth for the mum, you get low birth weights for the baby. And So, no, there are all kinds of problems, but these are exacerbated during pregnancy because of the physiological changes and the behavioral changes. So women's abdomens get bigger, they get warmer, more blood flow, and of course the mosquitoes like warm skin to bite, so they're attracted to a pregnant woman's belly. But then also you have the fact that, and any of you who've been pregnant and can sort of sympathize with this or empathize with it, but I know that at 9 months I was getting up quite a few times in the middle of the night to go to the toilet. And if your toilet isn't in your house and you have to go out, then any night-biting mosquitoes are going to see you as a tasty snack. So perhaps you can talk a little bit more about malaria, particularly as it's one of those diseases that we know there are climate change impacts on.
Yes, and we're certainly seeing in our area that malaria is a huge problem. Everybody's waiting for a malaria vaccine, and it would be nice to see that. But as we move forward, we're seeing malaria more throughout the whole year, and not just in certain seasons. And it's a huge problem on top of when you have chronic anemia and severe disease from malaria on top of HIV increase, it becomes a huge problem. And as the climate change is only going to make that worse. We're also seeing with, even before climate change really started, 50% of the people in Mozambique are stunted. Malnutrition is a huge problem. And climate change is only going to make that worse. So we're looking at ways to try to alleviate that and try to be ready as climate change occurs.
Right, and that's the second phase of your initiative, isn't it? So I'll put the PowerPoint back up if you'll bear with us while I share our screen again.
Yeah, we're just going to bring up the second half of the presentation here. And we spend a lot of time communicating with the community, and we're seeing that, you know, they come to us and said, yeah, you know, it's nice to have these things for our pregnant women, but what about food? What about nutrition? And what about finance? We just don't have resources and that are necessary. And so we looked at what led to good health. And really, as you look at the determinants of health, the number one determinant of health around the world, as you well know, is family income. So we looked at a family income generation project and got really excited about working with the community and the university and the local business. We developed what's called Project Frango. And we decided to do this with private funds, and we've had quite an interesting time with fundraising. That's been going very well. And what this project is a family income generation project. It's a partnership between a business called Novus Horizontes, which is a for-profit business run by a Zimbabwean gentleman who's been in Mozambique for the last 15 years. And they have a large-scale abattoir, large-scale hatchery, and service northern Mozambique with providing chicken at reasonable prices, and they're a very socially accountable company. And they were looking to try to consolidate teaching, because what they would do is hatch the chicks, take them to a local farmer who would grow them, and then 7 weeks later they would bring them to market. And they're looking for a place to teach groups of farm families. And so we partnered with them to, along with Universidad de Lirio, to develop a chicken raising training farm. So what happens is there'll be 48,000 chickens every 7 week cycle that would be brought to market. The biggest problem with our African colleagues is scale. Some producers, lots of small producers, but difficulty with processing and bringing things to scale. So here we have an opportunity to have a sustainable, resilient project where chickens are brought to market regularly, and the profits are used for three things. First of all, we build 8 large chicken raising barns, complete with water, electricity, and security. The university teaches the families gardening and family health, and the 16 families trained each year are given a portion of the profits. Those portions are banked so that at the end of 1 year, they have enough money to build their own 2,000 chicken per 7-week cycle farm, with continued support to bring the chickens to market from Novus Horizontes. The second way the profits are used is they maintain the farm. And the third way is the community gets a small amount because we're renting the land from them, and they're using this to continue the motorcycle ambulance system and other small projects that have been developed and are in the process of being developed. So here we have a project where 16 families each year on an ongoing basis are trained. It's self-sustainable. All the money from profits are used to maintain the farm and maintain the families. So from a donation point of view, people give money once and then it just keeps on going. So we're really keen about this sustained, resilient project that's going to address a huge need at developing things to scale and processing. And we plan to have this farm built in March and running by April. And so if you're interested, it's at projectfrango.com and you can follow it along. Frango, by the way, means healthy chicken in Portuguese, as opposed to the galinha, which is that tough old bird that runs around the farm all the time. So Project Frango is something that we're really keen about, and we're moving forward with that. And I think I'll pass it back to you.
All right, thank you very much. Well, you know what my next question is, because you're just about to embark on Project Frango. So what, if any, climate change elements are you going to consider, or have you considered, or will emerge as part of the participation in this webinar?
Yeah, well, the first thing that we are thinking about is water, and looking at ways to, other ways to access water just from groundwater. And looking at the barn and turning it into a rainwater catching facility. For example, we're going to be looking more at who gets access to water while the families are there. How do they get access to water? And so making sure that we address some of those issues as climate change increases, water is going to be more and more of an issue. Second thing was electricity. And fortunately in Mozambique, they've got a huge hydroelectric plant, which gives most of the electricity, but as things start to dry up, that might become a problem too. So we're going to have to look at ways to try to build electricity. Unfortunately, or fortunately, depending on how you look at it, the coal has been discovered in Mozambique, and every day long train loads of coal go through our city on the way to the coast. And so it looks like we may have to look at how to, whether we're going to use dirty coal for electricity or not, or how we can look at other ways. Just some small things like developing shade places for workers and things that as the sun energy becomes higher. We looked at using more of a, you could say a green roof by using the typical thatching and things that are used, but these roofs only last a couple of years. And so from a long-term sustainable point of view, we've decided to go with tin, but we're looking at that back and forth. But some of the exciting things is what to do with the waste, and the company that we're combining with takes their offal from the chicken, from the processing point of view, and they have a crocodile pit, and they feed the crocodiles and they sacrifice the crocodiles and sell the leather. So not much is wasted in this process. Also, the chicken fertilizer is being used for mango trees, because it's very good for mango trees. And the company is developing a juicing plant and things like that, so that there's again a processing level. Because so often, if you have a whole bunch of tangerines on the trees, they're great during tangerine season. They all fall down and they all rot away and they're not used. So we're really looking at sustainable ways to use this, and also the teaching by the University of Nutrition Department with regards to gardening and family health gives the people more diversification, organic resiliency. And so we're looking at those things, and this webinar has given me a clearer idea on some of those things. So those are things that come to mind. And we visited a farmer who, a number of kilometers away, who was part of the individual farmer program that this company had dealt with. And it was amazing to drive onto the farm and just see a well-built home, well-nourished children, children getting education, and families who were doing very well. And it all because of this project. And so we're keen to see that market open up and that move forward, and try to develop things to scale so that we can start it, build it, walk away, and let it be sustainable and resilient and run by our colleagues there. So we're continuing to try to do my favorite line when it comes to Canadians in development is we are catalysts. And catalysts are, I've always said that it's not the best word because scientifically a catalyst goes in, makes a chemical reaction happen, and comes out with no change to the catalyst. Well, as we know, if you go in and work with any group in Africa, you change dramatically. But the other thing that makes a chemical reaction move is an accelerant. An accelerant goes into the chemical reaction, gets all burned up and is gone, and the chemical reaction goes. So I'm not an accelerant, not truly a catalyst, somewhere in between. But that's what we are looking for, and this webinar is interesting to just say, as we look at our projects, what difference is climate change going to make?
And it's great that you've been able to reflect, but from what I've heard in our conversations preparing for this webinar, you're really starting from a position of strength in terms of it being multi-stakeholder, in terms of it being embedded locally with the university and the private sector, and also in terms of the shared benefits, that it's benefits to the community as a whole, as well as to the individual families, and obviously to the private sector business owners. So building that climate change element in is a great addition in terms of building resilience in the community. But you also mentioned the stunting, and obviously the nutrition is a really important piece of that. And we've talked about water and maternal health, but we haven't talked about sanitation. And that's the other part of this. There's a lot of evidence to indicate that poor sanitation is one of the key factors in stunting. And of course, from a maternal health perspective, if you have physical and cognitive development impairment because of lack of nutrition, then it becomes difficult to have healthy pregnancies and deliver healthy babies. If you are stunted, then you are small, and so you can get obstructed labor more easily. And if you don't have the proper nutrition as a young girl child, then you don't have the nutrition set up for pre-pregnancy and pregnancy. So the children of today become the mothers of tomorrow. And so it does become part of that life cycle around improving maternal health. And again, you're really trying to catch some of those. You mentioned the coal. And it brings me to a larger question in terms of there's one thing looking and considering climate change in your community and in your projects and the engagement that you have as a Canadian in Mozambique, but what's your sense of the Mozambique government and the national sort of approach to climate change?
Well, it's an interesting point. National governments are fighting a number of battles when it comes to governance. Just the headline yesterday in the Mozambican news was that with all the strike in oil and coal and gas and that has occurred, Mozambique has basically sold off a lot of it to other countries, and it has caused, in the long run, it looks like more difficulties than benefit. So everybody knows when we're working internationally that governance is a huge issue. And I don't know how best to address governance other than really this project, the Maternal Child Health Project that we're in is one of 19 projects funded with 2 teams that are over top of those 19 projects that take the research findings and move them to national levels across sub-Saharan Africa into parliament, into governance, and try to get evidence-based policy decisions made. And when we have these projects, all project meetings, we bring the decision makers, the provincial ministers, the national ministers, and share with them what the research is and how they make decisions and how we make decisions and how we can affect that. And so, you know, a politician doesn't want to hear a 7-page research project. They want to hear an elevator pitch of a paragraph. So how do you pass things on? So yes, governance is always an issue, but we're basically, I like to call ourselves idealistic realists. We have a strong belief that things are going to go well, but we live in the real world as well. So we walk that line of ambiguity, which is why I do emergency medicine. It is a line of ambiguity. So welcome to life, and I think we'll open to questions unless you have something further to add.
No, we can certainly open it up to a broader discussion. You can type your question into the chat box and we can answer it from there. If you'd like to ask a question or engage in a discussion, then please unmute yourself and we can do it that way as well. All I'll ask is, once you've asked your question or made your comment, can you please mute yourself back up so someone else knows that they can take a turn? Okay, over to you.
This is Vic in Victoria. Can you hear me okay?
We can. Hello, Vic.
So a question to Ron on the last point of what you're saying. Things are still in a state of ambiguity nationally about climate change policy and so on. It made me think about a couple of things, and we need more discussion perhaps. One is, would you be interested, maybe the two of you together, in an ongoing dialogue with our working group in the coalition on climate change and what could be done in Mozambique about that? A couple of thoughts. One, maybe we could help the university, your new University of Lauria, see if they actually have a course on climate change, and if not, help create one. And second, you may know that the Canadian Federation of Medical Students has just started a project to make sure there's a climate change curriculum of some kind in every medical school. And whether there's a gang at U of S already started on that or not, we could find out. But I'm actually in touch with the leaders of the CFMS, and maybe we could help connect to students at U of S as well. So those are a couple of thoughts to think about.
Well, thank you very much, Vic. Yes, I think that using, pardon me, using a national coalition is always helpful to reach other national governments. The University of Saskatchewan has also been on the forefront in social accountability, and Laurie Hansen is the newly appointed director of the Division of Social Accountability of the College of Medicine, and you're bringing the idea of climate change into the curriculum is smack dab in the middle of her purvey, and so I'm sure that they'll continue to work on that and would appreciate support from CFMS and from the Global Health Coalition as well.
And members of the Climate Change Working Group are actually developing some educational materials for Tanzania around climate change. So there are some other materials that would be useful to be able to consolidate those in some way, shape or form for sure, and have some core modules. It's a great idea, Vic. Does anyone else have any other comments or questions or suggestions? What have you been doing in your projects? and how have you accounted for climate change, particularly around maternal and newborn health? Oh, I see that there's a question here about the main achievements of your program. So Ron, perhaps you can describe the main achievements that you've had to date.
Yeah, we have the motorcycle ambulance system up and running, the hospital trained and working, and we've been a little bit stymied by the fact that Mozambique has had a significant change from a governance point of view, where they had the government absconded with $2.4 billion. So the IMF and World Bank and Americans and Canadians all pulled out. So the government is working on their own, and the hospital budget has dropped by 80%. So resources are very low. So now we are fighting the battle of having some good things in place, but having to ensure that small things like gloves and OR equipment in the way of sheets and things are all available. So sometimes the whole old adage, for the want of a needle, we all starved. But it's one of those things where one has to continue to be an idealistic realist. So we are moving forward. So that's what we've got going so far. We also have 20 local health groups who are with a family health champion in each one, who are teaching the local communities. There's a strong connection with the community and the hospital that meet every 3 months and go over a form policy form developed by the Mozambican government to go over complaints and things. And so we're really seeing a reduction in local complaints and local problems with corruption. So things are, there are positives and there are negatives, and we're excited by the fact that the university team that we're working with, Universidad de Lirio, their capacity has increased significantly, and they've taken on this project, and it's getting to a point where I can walk away, which if I can work myself out of a job, it's fantastic. So those are, just forgot to mention as well, we're working closely with the Provincial Department of Health, the community, the university, and U of S. So, and we've brought in we've have regular stakeholder meetings with other NGOs, et cetera, who come into the project and provide their expertise. And we've been working closely with some of the American groups and some of the other groups in the area.
Thank you for that question, Sana. And you've just opened up nicely to Elizabeth's question, which is, could you also speak more about the community engagement and allyship in your project as an approach to sustainability? Because it really is, as I said in one of my responses, that cross-sectoral local engagement, multiple players, multiple actors, is really something I believe is important for sustainability. But please.
Yeah. Well, I agree with you. I went into Haiti once and came out in the airport. There were 8 different groups with T-shirts that said this group for Haiti and that group for Haiti, but there was no coordination. So what we've done for community engagement is we've met with, it's really important to meet with the traditional leadership, and the Portuguese term is regulo. So you meet with the regulo, who is actually the chief or king of the area, and we got their blessing. They were sitting there, and I was quite amazed to see 50-year-old men say, our teenager girls are getting pregnant soon, they're dying, what can we do? And so we went into the community and had focus groups in a huge meeting at the University of adolescent women, childbearing age women, traditional birth attendants, traditional leaders, adult men, adolescent men, and asked them the question, why are women dying in pregnancy and why are babies dying? And we went over all their questions and answers, and we had groups discussions and found out which ones layered out at the top, and then we built the project around those indicators. So the community said, we don't have this, we addressed it. And now as we go over these years, we say, okay, this is what we're doing to address those questions you've had. And we've had a number of other meetings with them. And just an example, we had, it's a co-gestion, a co-management committee between the hospital and the community. And that sounds sort of like one of those, oh yeah, University Foundation, one community member and 25 people from the hospital. Well, this is 2 people from the hospital and 45 people from the community. And we went in and had a very interesting discussion about needs and activities. And then we went next door and heard traditional drumming, and my wife started dancing and they started dressing her up, and everybody had a good laugh and a lot of fun. So it's a combination of work and connection, and just has become the point where it's not the community, but it's Carlos, Celso, Jaibo, your friends that you're working with.
And there have been a couple of questions around checklists of data collection tools to be able to help take climate change into account, and some of the strategies that we can use to ensure that climate change is considered. And perhaps I can start that one off a little bit. I believe that that is a gap in some ways. There are some assessment tools. For example, WHO and others have come out with a wash in healthcare facilities assessment tool, which is water sanitation hygiene, which at least starts asking where the water is coming from, how reliable that source is. And so they're not specific to climate change, but they are starting that conversation. In terms of strategies, I would suggest that it's the education and awareness, which is why we've put these webinars on from the, and why CCGHR has struck a working group on climate change and health. It's the knowledge and awareness that's the initial strategy for engaging people, because I don't want to pick on you, Ron, and you've been very brave when we started suggesting this at letting us do this way and sort of say, okay, we know that you didn't consider climate change, but can you reflect on that? So I know this has been helpful for you. Are there any other strategies that would be useful, or that you'd like to be able to go and click on and say, yes, I want that tool?
Yeah, no, I think that what would be helpful to me right now, for example, from the WHO, I get a regular email of new information on maternal child health. And when I read them, they are clear, concise, and to the point. And so having a stream where you say, here is a checklist to use in your project. Also, maybe addressing the international team at universities. So, for example, my international team will tell me, hey, here's a project that you should look at. And you say, okay, there's gender in there, there's equity in there. Why isn't there climate change in there? So going to the national funders who are providing the money and saying, why aren't you including that? Because you're including a lot of other things that have not been included in the past.
And it's certainly something that we can at least start a checklist, and I'm happy to go and look. The other element here that's important is transdisciplinary teams. If you only have physicians, or you only have water engineers, or you only have whatever other group, then it is really difficult to think about the medical plus the well-being plus the community engagement plus the water sanitation hygiene plus climate change. And so bringing together those expertise and having those conversations both within the community, because communities know what their problems are. They may not know or have the resources to solve them, but again, the fact that you sat down and that you had those conversations before you even started, I believe, was a criteria in how successful you've been to this point. So I don't know if anyone else has any strategies or tools that they've come across that they would like to add in to the chat that we can all share and take as resources. And as I say, I will follow up and look for some more tools and share that WHO wash in healthcare facilities and a couple of other tools that I'm aware of from that water health perspective. We have another question here, and it goes to corruption in the hospital and your comment on corruption. And It's whether these strategies have a place to reduce corruption, or whether there are other solutions that need to be engaged as well.
Well, I think you don't want to be the idealist with your eyes closed saying that, oh, I'm just going to do this and corruption's going to go away. There's obviously a bit of a lifestyle that is developed that is different than ours when it comes to bribery, etc. But what's really important is to use Mozambican policies in Mozambique for Mozambicans. So what came out, the Mozambican government came out with a really good overview questionnaire that the hospital and the community sit down with, and they say, did you have any problem in this area? If so, what was it? Did you have problems in that area? And they go through everything systematically. The community says yes or no. They have a good discussion. And at the bottom say, what are we going to do about this? When is it going to be settled? And when our next meeting in 3 months, we expect this and this to happen. So we are the first hospital in Mozambique to actually implement that. And it's been very effective to help get that involved in their regular meeting that Canadians really have nothing to do with. We just found a tool and brought it in. And secondly, we've been giving a little bit of money for a employee of the month type thing to try to do some positive supports there. And we're looking at ways to obviously work closely with the provincial government when it comes to where they're putting their staff, etc. For example, when the election came, they took nurses out of the district hospital and stuck them all over in small one-room places where they weren't as effective, destroyed the effective working of the district hospital just so that people would vote for them because they saw a nurse in their area. So the Canadians went and talked with the local management who, along with said, okay, we will talk with the hospital manager before any of this is done. So whether that's going to really happen or not is one thing, but at least there was a process in which we could be a bit of a catalyst. And by doing that once, it gives the hospital manager a clear route to do it again when we're not there and hopefully have some success. So these are 3 small things that we think are helpful, but trying to, from a sustainable point of view, trying to use Mozambican policies in Mozambique for Mozambique.
Great, thank you. I don't know if there are any other questions or comments. There is. Thank you very much, Ron. How projects like this on climate change are working on limiting or reducing the power imbalance between the North and South, which is a global health challenge. It absolutely is. Did you have some comments on that, Ron?
I'm going to let you answer that.
I can certainly go to that, and it's within the context of the Sustainable Development Goals, and absolutely it's the transfer of knowledge and transfer of technology. I don't think we've got it right yet. Having projects like this that frame it in terms of solving the problems of Mozambicans, for Mozambicans, engaging with Mozambicans as much as possible and allowing the solutions to come through Mozambicans is critical, because as Ron said, it brings that, you're a catalyst or whatever you want to call yourself. You can just be a chemical reaction if you want, just don't be an explosion.
Yes,
but yes. The point is that it's on the ground and it's sustainable, and so there are no power imbalances at the end. Well, I shouldn't say that, there are always local power imbalances, but in terms of that external internal, you're taking that away by embedding it from the beginning. And so I agree with you, Elizabeth, in terms of that power imbalance being huge, and there does need to be technology transfer. And it was interesting with the motorbike story that you have sort of set yourself up for success no matter what climate change impacts the scene, just from being conservative in terms of making sure that the bikes have enough power and to meet current conditions and exceed current conditions. So there are always these locally grown solutions or solutions that can be transferred there, because again, it was a local person, a local Mozambican from Saskatoon. I don't know quite how he ended up in Saskatoon, but that's probably another story, who has now put this in place back in Mozambique. And it's not just technology transfer from north to south and knowledge transfer, it's knowledge transfer within the south as well, because a lot of the solutions that come from the north, they require large amounts of electricity or large capital costs. And so often it's the local solutions that are the ones that are more sustainable. And so how do we share those solutions and those projects? And how do we share failures as well as successes? If you'd gone with that less powerful motorbike, would you have been as quick to share that, no, you needed to spend that extra money? And we're in a society where we don't share those failures quite as often. And that's another element that's really important in terms of getting the knowledge, the technical knowledge, and the solutions out there to be able to scale up and scale out. Madeline, I'm going to put you on the spot because I have been thinking about a couple of other resources, and particularly from the WASH sector. We surveyed over 150 local projects and asked them for their sort of building blocks for success, and came up with 16 or 17 points for community-based projects. I'm just wondering how we can share some of these resources back with the people on the call. And perhaps you could indicate to us what may be the best way to do that.
Yeah, I'm definitely happy to list any of the resources on the webpage for the webinar. We can share those by email as well. And I asked the question also because we're currently working on a project that's going to try to build some of those some tools, and one of the priority themes that we're considering is climate change, among others. But so, you know, we'll definitely be surveying our members about what they're using, if there are any tools that are useful. And so in addition to whatever resources you share with us, there will be more coming in 2019.
That's great. Thank you ever so much. So please come back to the website and have a look. We will post some of those materials up, and also we will, if you're okay, we can email them to you. So just that would be through Madeline. So just indicate to Madeline that you're okay, because we don't want to fill up your inboxes unnecessarily or without permission. So, but we're happy to engage with you on whatever materials we find, and watch this space for 2019 as CCGHR more broadly comes up with some tools for authentic partnerships and engagement around different themes. Ron, did you want to have the last word before we close it down?
I would never want to have the last word. You speak so well. So I just want to thank you very much for this opportunity, and I must admit it's slightly different than pediatric emergency, but always enthralling, to say the least.
Well, it's definitely been a pleasure, Ron. I think we were sort of thrown together via David, and it's been a great conversation, and I look forward to it continuing. And we'll certainly be engaging in conversations around climate change and maternal and newborn health here at the University of Saskatchewan, and also through CCGHR and the Working Group on Climate Change and Health. If you want to join us, you're more than welcome. And thank you ever so much for your attention, for your participation. Have a great holiday break, and Madeline will be back in touch with the 2019 webinar series. Take care, everyone, and have a wonderful rest of the day.
Thanks,